I'm Beth, I'm your RUSU President for 2023, and during our Let's Get Consensual campaign, we asked you to give us your burning questions about sex, consent and relationships, and today we have got Laura Miano to answer those questions.
Hi, I'm Laura Miano. I'm a sexologist and I'm the founder of sex toy concept store Posmo.
Cool. One of the kind of common trends that we're seeing through questions as well is a lot of people losing their libido, especially after heading into relationships. What do you kind of recommend for people that are dealing with that kind of problem or challenge, and how to kind of get over that if they're trying to boost their libido as well?
Yeah. It's common for your libido to drop when you are in a long-term relationship. If you think about the first year or 2 years of a relationship, there is the limerence period, so it's like the honeymoon period where you're kind of naturally far more motivated to have sex with your partner. Also, you're both growing closer together, and sometimes your motivation to have sex might actually be that you're wanting to build your attachment with that person. Once you kind of have them, you're both secure. Sometimes the desire for sex can drop off if that was your main motivation for sex before. Also, at the start of relationships, you're learning about each other a lot. You're doing lots of fun things which naturally fill your cup up. And when I say that, I mean over a certain period of time, lots of different things that your partner does, the way the two of you interact, fills your cup up to the point where maybe, when you eventually go to bed one night, your cup's already 80% full, all you need is a little bit of kissing, a little bit of, touching, and then you're ready to go. At the start of a relationship, you're doing far more things that fill that cup up. As you get more comfortable, things like date nights, quality time, learning about each other, sharing fun experiences, that can drop off. So your opportunity to fill the cup up becomes less and less. So I would say think about what would fill your cup up, whether it doesn't have to be sexual things. It can be like relationship things, ways that you will feel more fulfilled in your relationship. See if you can bring some of those things back in. I would also wonder if you and your partner are you really understand each other's bodies. Do you know what brings both of you pleasure? Are you able to comfortably communicate about it and ask what each other likes? Are you also comfortable to explore different things with your partner? Or have you hit a little bit of a stalemate? Maybe you're kind of like you're just kind of doing the same thing every time you have sex.
The routine of it.
Exactly. Things like unresolved conflicts can be a big one. Just sometimes a lack of desire for sex in a relationship can be a reflection of your feelings towards the relationship. So honestly, there's so many different things. Low libido is a really complex sexual concern. So if it is something that you've been experiencing for a while, I would say book in with a sex therapist, because it can be a really hard one to identify and work with without a sex therapist.
Yeah, and I guess it's always good to have that person to guide you through it as a couple as well.
Yeah, for sure.
I guess following up on that question, another thing that came through the questions as well as people losing their libido through, I guess, watching too many porn videos or content. What can you kind of recommend for those people as well that are dealing with that challenge?
Yeah, so porn is an interesting one because it's a super stimulus. So if you pair your sexual functioning with something like a super stimulus, it means when you don't have that super stimulus, your body won't respond. So for example, if your body is used to responding with arousal and with orgasm to something like porn, which floods your brain with dopamine, a partnered experience just simply won't flood your brain in a similar way. So if your body is waiting for that flooding to happen and then it doesn't, it won't respond with desire or arousal. So it's common for people to lose desire for sex when they are really relying on porn and watching a lot of porn. What I would say is, I guess try and reduce it if you can. Sometimes porn use can feel a bit compulsive, so if someone is struggling to reduce the amount they watch porn, I would say book in with a psychologist or a sexologist, because professional help might be a little bit more needed in that situation. But if it's possible to kind of control it on your own, then I would say try and reduce it. Try to bring in different types of like ways to become aroused. It's okay to keep the porn, but the idea is to be able to become aroused to different types of experiences. So using fantasy, using maybe like an audio porn, and then using a visual porn every now and again.
Yeah, absolutely. We are in our therapy era.
Yes, absolutely.
Sure.